It's a treat to be here. The technology and patient-caregiver relationship is just such a rich topic. We could begin anywhere. But I just want to look out here briefly and just get some hands in the air for anybody who feels like technology is awesome, can't believe the things it's going to be able to make us do. We're going to have all sorts of possibilities in the future, better healthcare, better physicians, better outcomes, happier people. And now how many people are afraid that just putting more computers in between people, more screens in offices is kind of scary, and that's also a place where we're going? Well, the good news is we get to decide our future. The people in this room and the people in the city, the technologists, the providers, the patients, get to figure out where we go from here, and we have a panel to talk about these issues.
I think by and large, as a general observation, anytime there's a profound technology, whether it's electrification or automobiles or go through the list, there's upside and opportunity, but there's downside that's created. And it's always this balance of mitigating the downside while leveraging the upside. And we'll have similar conversations, are having similar conversations here. That being said, I think between my experience at Partners and my experience doing what I do now, I think there's 4 categories or areas in which the technology can facilitate what is fundamentally a human interaction between 2 people at a very deep level, a very emotional level, et cetera. First area is just to get things to work. You know, that the transition of care works, the follow-up on abnormal result works, the scheduling works. It's easy to say, it's just really hard to do. And to the degree things don't work surrounding the delivery of care, a lot of time is wasted, a lot of frustration occurs, and frankly, you know, people come out of this saying, you don't care about me at all, this crap doesn't work. It's like the airline who loses your bags and has got the, well, you know, I'm sure they're somewhere on the globe type attitude towards all of this stuff. So fundamentally, and it's a lot of where we've been focusing our energies as an industry for several decades, is just getting things to work. And that will remain a critical thing to do as a centerpiece, because to the degree it doesn't, it's distracting. The second is that and all of us have observations on the nature of human interactions, whether it's parents and children or spouses, and I'm not a caregiver, but I've seen them on TV and I hang out with people like John. But nonetheless, the foundation of any good relationship, one of which is communication. Just the ability to talk and to share and to ask questions, sometimes deep questions, sometimes not so deep questions, doesn't really matter. But the point is, there's a lot of technology which facilitates communication, Skype and email and shared communities, et cetera, that allow people to share and converse and to cement the relationship even when they're not physically sitting across the table from each other. So that's the second area. The third area is that all relationships that thrive have some core set of shared knowledge about what to do, and whether it's a couple deciding how they want to retire and what that ought to look like, or an employee and a subordinate or a boss, talking about here's what we do. There's a shared understanding and knowledge base. It might be differential. Some party knows more than the others, but nonetheless, there's a shared base. So the ability to use the technology to have shared plans of care, shared understanding of what the test results mean, shared understanding of what the decisions that have to go, we could do A, we could do B as we go forward. And then the technology can facilitate a lot of that sharing of knowledge, and to make sure that to the degree that it's necessary, possible, or desirable, that there's this fundamental base that exists. That's the third category. And I'm sure by the time we're done, we'll have wrapped up all 3. And then we'll move into the fourth one, which is really the most I think emerging in lots of ways and drawing an enormous amount of investment and energy across a wide range of industries, which is to have the machine begin to personalize on your behalf, where the machine is saying, I understand, I think I do, enough about you and what you like, what you don't like, what your education level is, this, that, and the other. I understand enough about the context of which we were engaged in and enough about the other care or other participants here that I'm going to make certain suggestions and tailor it. That's got to go on. And obviously the big place is getting a lot of energy these days is targeting of advertising. Just to say John Glasser, middle-aged guy, decaying rapidly, incapable of engaging in most commerce with the female species, including his daughter and his wife. We got some help for guys like John. There's a lot of them out there. A lot of them out there. And in fact, I know you're all here for me to work through a certain series of issues I have with my kids. But nonetheless, it is the ability of the machine to be smart and to alter what it presents, and whether the alteration is here's what's going to happen to you today, to decide what reading level do you really want to engage in these types of things. How far into this conversation do you really want to go? Some people want to go deep into the conversation. Some people don't want to go deep into the conversation. So I think we're going to be learning over time, and that cascades through all three. The process changes, the sharing, the communication is this burgeoning area called, let's see if the machine can anticipate correctly the right series of things that need to occur.
My father died a year and a half ago. He had multiple sclerosis, he had myelodysplastic syndrome, he had 3 heart attacks. Now, I did not know, because he's a Los Angeles-based guy, that he was actually using high-dose steroids in the 24 hours before I would visit him to mask all his symptoms. So if he would have been wearing, say, a device like this, which measures activity, pulse ox, heart rate, sleep patterns, I would have been able to say on a device like this, oh, gee, he walks 5,000 steps a day when I visit and 5 steps a day when I don't. And I would have been fundamentally able to advise his care in a very different way than it ended up playing out. My mother broke her hip a year and a half ago. She ended up in the emergency department, and the emergency physician said, so what meds do you take? And she said, well, the red one, the blue one, and sometimes the green one. And they said, oh, well, there's this fancy SureScripts network. I can actually look up your meds, everything you've been prescribed in the last 23 years, and we'll put you on all of them. And so by the time I got to LA, she was mumbling in a corner, completely incoherent as to person, place, or purpose. Because, of course, these were never meds she should be on. And they had no capacity, as John said, to actually reach into her primary care office 1 mile away from the hospital and see what meds she was taking. So, of course, this illustrates a technology solution with interoperability that could have prevented errors and harm. My wife was diagnosed with stage 3A breast cancer in December of 2011. She went to one of your very fine hospitals and actually got excellent care. And the very fine hospital, who did all the right things from an IT perspective, said you can go to medical records Monday through Friday, 8 to 5. We'll print out a copy of your electronic record, and you can drive it to all of your other caregivers around Boston. We have an information superhighway. It's called the Mass Pike. So, of course, no newly diagnosed cancer patient should ever have to coordinate their care on paper and CDs across hospitals that are as technologically advanced as ours. So it's true, we're standing across from the Apple Store, and there's now iPhone 6s and soon Apple Watches to be flowing out of that store. I do worry that we could get a little bit over-technical, but there are aspects of these new products that I look forward to. The Apple iPhone in 2 weeks will have an application called HealthKit, which will be able to take all the data from these sorts of things in your home, your bathroom scale, and with your consent, send it off to caregivers, care teams, care managers, what I would call a care traffic controller, and be able to say, oh, you're a congestive heart failure patient. You've had a weight gain of 7 pounds over the weekend. Let's arrange a home care visit. So we're on the cusp of actually having consumer-grade technology being able to integrate the devices in your home with a care team, and that way we can deliver timely, compassionate care. It isn't a keyboard between you and the doctor. It's with your consent, knitting that team together so we never again have to drive records around on the Mass Pike.
It's great we talk about all these tools and making them work, but the challenge is to create tools that really are easy, integrate easily, and that people could actually know how to use. One of my colleagues said, Natalie, I want to use a product that is simple and stupid, or else I'm not going to use it. And that's really the challenge, is making products in technology that really meet the needs of patients and are easy and simple to use. Prior to MD Capsule, I was an internist for 15 years in a multi-provider practice. We had a leading EHR in our practice, and yet myself, my staff, other providers, we spent countless hours trying to fax, print, scan, you name it, to physical therapists, occupational therapists, other providers that were not in the system. That time spent away from direct patient care. So that really, the two, and also I would be in the exam room, I would hold my tablet, and patients would ask me, well, why can't you get my info in there? Isn't it all in there? So they wouldn't really understand that even though I had a leading EHR, all the information about them wasn't in one place. We need to make these tools easy for patients and providers to use, and we need them to be more personal and more cohesive. That's really so it's not just about work, it's really about saying, what is communication about? What do we mean by communication? Is it a quick text message? Is it a quick phone call? What does it really mean? What I find equally important is today to bring to the table is a patient's voice. I mean, we're all patients in one time or another, but I wanted to, I asked a patient of mine a while ago to write her experience or what her thoughts were about the patient-provider relationship and how technology factors in her care. And I just want to briefly take an excerpt from that. Cindy says, my story starts way back at around 5 when I had first known my first major migraine attack. Fast forward 36 years, and I'm no closer to a cure. I have periods where they are less debilitating, but like that annoying neighborhood kid your parents make you hang out with, they just won't go away. Last year was one of the most absolute worst periods in my life dealing with migraines and the medical system. I was in and out of emergency rooms, neurology offices, and my primary care physician. I spent agonizing time on hold with doctors' offices, trying to access different portals, but unable to figure out their complexity. I was having major attacks twice a week for a period of over a year. For me, a major attack is completely debilitating, lasting multiple days. Now, mind you, I had to attempt to keep my job through all of this as I was a sole provider. Emergency room docs didn't want to deal with just a headache in room 3. My neurologist wanted to help, but nothing he suggested worked in regards to preventative medicine. The only thing that medicine did was prevent me from thinking clearly. For me and others like me, sometimes it's just having that compassionate doctor who really gets it. They may not be able to fix the problem, but we know that they have our back and will do anything within their power to help. Had I not had that PCP during that period, I am fairly certain I would not have made it. Writing endless work notes, filling out yearly and quarterly FMLA reports so I could keep my job. I knew these weren't her responsibility, so she could have very well pawned me off to the neurologist, but she never did. She didn't because she knew it would be a much more difficult process for me, and no matter how inundated with other work, she never let me down. These are not things you can stick in some cool, new high-tech gadget worth millions. There is no high-tech gadget that would have gotten me through that time. It was simply one doctor taking the time to truly understand her patient's unique situation and doing what she could to make a load a lot more bearable.
So as an emergency physician for over 20-some years, working for Medicare Part B carrier and working for CMS, so I now have the most wonderful job of all because I now represent 38 million people as the Chief Medical Officer for AARP services. So when you really think about it, I've been a provider of care, a payer of care, a bureaucrat, and now it's about us. It's really great. Over the last 6 years while I've been ARP, I have to say I've really totally changed my view of that doctor-patient relationship, and really through wearing the lens of the consumer. And you've heard it through each of our panelists before, and they're all the techie guys. I'm not the non-techie. I'm just representing, that little, patient sitting there with the little robe waiting to be seen. But I would say there are 3 things we really want to keep in mind that I've learned at ARP. The first is, we in healthcare really believe that healthcare is that doctor's office, the hospital visit, the emergency department. But if you're a patient or a consumer, it's your everyday decisions at home, right? It's what you eat. It's whether your kids just went off to college and left the house, whether you lost your job, you just got divorced, or just got married. Those are where the healthcare decisions are making and how you guide your life. So if you really want this technology to work, we have to capture a way to capture what is happening at home. This is what we want to capture, is how you live, how do you take your medicines. You know, I love how, you know, one of my colleagues who was really good at monitoring his father-in-law's medication. He had about 10 different medications, you know, and would count the pills every single day to make sure he took all the right medicines. And his father-in-law ended up in the emergency department, and he said, "What happened?" And his father said, "Well, you know, I had all these pills, this one 4 times a day, this one 3 times a day, so I figured if I have to take all these pills, why don't I just take them all at once at 12 noon and be done with it?" So unless we know what they're doing at home and how they're doing it and how they're reacting, all the guidance in the world in the doctor's office isn't going to make it. The second big aha that I've had, and I think you've heard it through some of the panelists here, is it really is all about connectivity. It's all about connection. One thing we've learned at ARP is the 2 most powerful drivers is having a sense of purpose and being connected to others, family, friends, etc. So any technology that we have has to include how do you keep that warmth, that compassion, that empathy that transmits across the technology, or that the doctor sitting there writing in the record still maintains the eye contact and that touch and the hand holding. And the last piece is not to be, you know, all down, but it's you know, we have a real opportunity in technology. If you really think about what drives consumers to buy, and look at this, 25% of the population is between 45 and 64, and yet they spend 40% of the dollars on technology. If you think about it, some 71% of baby boomers between 50 and 64 are on social networks daily, 71%. And you think the 65-year-olds and over aren't? They are. Some 59% are actually on social networks daily. And why are they doing it? Because it does one of 3 things for you, or preferably all 3. It saves you time, it saves you money, and it reduces a pain point and a stress point. So I hear a lot about we're not engaging the consumers, and why aren't they getting engaged, and why aren't they getting empowered? It's because we failed to identify what really matters at heart. To a consumer, to a doctor, right? Health is our end goal, right? Our goal is hemoglobin A1C, and can we check that off our pay-for-performance box? To a consumer, health is simply a tool to live better every single day. And if we can capture that optimism, that excitement, and the what's next in our lives, you know, this is then, you won't have that problem of where's the engagement and excitement. So one last little story. My father, who was, you know, about 80 years old, his brother in China was diagnosed with liver cancer. And my father came to me and said, "Oh my God, what am I going to do? When do I go to China? I got to go to China. I got to see him before he dies. But what if he, you know, but what if he dies before I get there? What if I'm there too soon?" And he was stewing about this, and his brother in China at 79 years old says to my dad, who's 80 years old, and said, No. I tell you what, you get this little computer thingy, and there's this free software, you know, it's kind of called Skype. And you know what? Why don't we just talk, and you get a little camera, and we can do this. Well, for the next 3 months, every single week, my dad was in his living room talking to his brother in his living room. He learned how to use the computer. He learned how to Skype. And he said it was the most wonderful thing that he could see his brother in peace. And even though he was dying, the 2 conversed the last 3 months of his life. It saved him time, it saved him money, and it surely reduced a pain point. That's where we need to go.